Once the procedure is started, you will pull out of the kit box. This is the kit box we talked about earlier. You'll pull this out, and this is the actual pacing wire. And go ahead and open it for him. Just remember the inside is sterile. Don't touch anything in the inside. Open that for him. And then he's ready to start the procedure. Now, the beginning of this is just like any other central line insertion. So here, Matt is helping us here. So he'll need a set of sterile gloves. Dr. Umat wears 7.5. He'll get the drape out. He'll drape the site. Now we're going to be doing which approach? We're going to be doing the jugular approach. So the first thing he's going to have to do is, of course, access the site.
Get that. Get blood return.
So he's got a blood return. And he's going to use the stylet or the guide wire. Pull the needle out.
Cut.
Cut the site just a little bit larger.
Put the dilator in the sheath.
Put the dilator in the sheath, and now he's putting the dilator down the guide wire. And make sure he gets it into the jugular. Then he'll pull the guide wire out and the stylet out.
Alright, now I'm ready for the bipolar casing lock, catheter, and the cover.
So now he's ready for this. So Dr. Umat will reach in and grab that. So make sure you have it open for him. Now, will he test the balloon?
Yes, he will test
So
the
he
balloon.
will test the balloon on the catheter. Remember, this is the white bipolar pacing wire. Test the balloon to make sure that it works.
Does work.
So the balloon inflates. Show that one more time. Show me that tip of the... So this is what he's looking for.
The nurse will assist in opening this for him.
So you will have to open this catheter protector and just drop it in the box for him when he tells you. So he'll take that and he will thread it onto the guide wire. And this will just keep the that part of the guide wire sterile so he can reposition it if he has to.
Is there at least 10 centimeters to make sure it's past the...
So he'll insert it at least 10 centimeters. The idea is he's got to get it down into the right ventricle. So he'll use the balloon to float it down.
And he'll be under fluoroscopy. If he's under fluoroscopy, he'll be checking where the tip is in multiple places until he sees it at the right ventricle. If he's at bedside, he's just going to judge by length.
So you should be watching the monitor for any PVCs, any ventricular, because you're going to be irritating that right ventricle. So you need to watch the rhythm while he's doing this.
Okay. That syringe always stays on and it's clamped off. See, there's a red arrow. That means it's unclamped. See how air's coming back? Push it. Offset red arrow means that it's clamped and no air is going to reflux back into that syringe. And now also, these are sterile in this.
So then he'll reach for these. Now these are in the package with the pacing wire.
They are also in the pacing box if for
Yeah,
some
also
reason
in
they're
the
not there.
pacing box in case for some reason they didn't come. So he'll take these two pieces and slide them onto the end of the pacing wire. Well, there's two of them.
Okay. He'd be taping the sight down at this point.
So he's going to be taping and securing the sight.
You also get blood return from this, which can act as a point of access for the nurses. They can get blood, get meds. Normally he wants a infusion going at KVO around anywhere from 30 to 75 mLs an hour to keep that patent. Right, then
Now, the next piece is going to be this. So, you can open it for him when he tells you, and he can reach in and grab it. Now, he will take one end of that.
proximal, go to positive.
Proximal, you see it's labeled on the wire.
Thank you. Thank you for doing all that.
Proximal, and that will go
See you later.
into the positive side of the cable. So P for P, proximal positive, and then the one labeled distal goes into the negative port. Make sure that they're unscrewed when he puts them in. Make sure you screw them down securely so they can't be pulled out. So then the other end of that will clip into the pacer box. Just like that. And then at this point, he generally will have you hand it to him. On button at the bottom. Then he will set the rate for whatever he wants.
Crank that all the way
And
down.
then he'll crank up the output all the way up to 20. And then he'll start backing it down until he loses capture. And then he'll turn it up just a little bit more. Generally, he will leave it on asynchronous pacing for a while. And then you're done. Now, the other thing I want to show you is how to change the battery. So at the very end, you're going to pull the whole thing out, and it's a 9-volt battery, which there is always a spare in the pacer box. So in the pacer box, that's where the spare is, and then it just goes into the end. And there's a button that you have to push on the side, one on each side, right? You squeeze it together, and the end should open up. Just slip in a new battery, and you're done. And that is it. Thank you.